mynews.studio.
Picture this. In Botswana, a mother holds her newborn, HIV-free. How did we reach this point?
Today is July 20th, 2025. The numbers really lay it out. Back in 2010, more than 500,000 infants got HIV from their mothers each year. Now, that number's around 120,000. So, a 62% drop in just over a decade.
It's a dramatic change. What's behind it? The main driver has been getting antiretroviral therapy, or ART, to pregnant women with HIV. Globally, 84% of those women now get treatment. To compare, in the early 2000s, transmission rates without any intervention could reach 45%.
Those early years were tough. The first breakthrough was single-dose nevirapine. But when the lifelong triple ART regimens came in, things really shifted. Why did that change everything?
Because when ART is taken consistently, it suppresses the virus to undetectable levels. That brings the risk of passing HIV to a baby down to nearly zero. That's why countries like Botswana and South Africa have brought transmission rates below 5%. And in high-income countries, it's gone as low as 0.2%.
The programs that made this possible, like WHO's Option B+ and PEPFAR, they've mostly focused on sub-Saharan Africa, right?
Right. Sub-Saharan Africa carried the highest burden. These initiatives scaled up treatment, wove HIV prevention into routine maternal and childcare, and invested in healthcare staff and infrastructure. But
there's a catch. Even with the right medication, what's still getting in the way?
Stigma's a big one. Some women avoid even getting tested because they worry about being shunned by their communities or even by health workers. Then there's the system itself. Clinics that are short-staffed, labs that sometimes don't deliver, or medicine supplies that run out. Imagine starting treatment and then finding out there's no medicine left.
And it's not just about starting treatment. Staying on treatment is hard. Women move, lose support, or face economic pressure. Many drop out, raising the risk of HIV transmission during breastfeeding or in future pregnancies.
Socioeconomic factors feed into this too. Poverty, gender-based violence, not enough education. All of it makes sticking with treatment harder. It's a complicated web.
But some solutions have worked. Can you share examples that might help with other health issues too?
A big one is integrating HIV prevention into general maternal and child health services, so women don't have to go to different clinics for ART and prenatal care. Community involvement is also key. Peer educators, usually women living with HIV themselves, help others find their way through treatment and push back against stigma.
And task shifting, training local workers to deliver care, not just specialists. That's really expanded access, especially in rural places. Point-of-care diagnostics too, like same-day infant testing, mean babies can start treatment right away.
And data systems set up for HIV have helped spot gaps and track progress. Plus, international funding, especially from donors, has kept programs going. But funding isn't always stable. Sustainability is a big question.
So if outside funding dries up, how do you keep the gains?
Building up local capacity is crucial. Training and empowering local workers, teaming up with community organizations, and making sure people affected by HIV have a say in how programs are designed. That's what builds trust and keeps things running, even if funding shifts.
And if you strengthen the health system as a whole, better supply chains, integrated services, data that's well managed, then the improvements last, even after a donor leaves.
Community ownership makes a difference too. People need to feel these programs belong to them, not just something brought in from the outside. That's what gives them staying power.
So if we lose momentum now, what's really at stake?
Every year, more than 230,000 babies are protected from HIV. But the world isn't on track to reach the 2030 elimination target. If we lose focus, if fewer women stay in care, or if the hardest to reach are left out, we could see transmission rates rise again.
Still, this stands out as one of public health's biggest achievements. It proves that with the right science, funding, and community effort, even tough challenges can be tackled.
And the strategies here, integrating services, engaging communities, building local leadership, these can work for other issues too. Think vaccines, maternal health, tuberculosis.
So the takeaway is targeted investment, new approaches, and partnership work, but they need steady commitment. Are we prepared to keep going?
That's what it comes down to. The fight isn't over, but we have a roadmap.
Today, fewer babies are born with HIV, but keeping that progress means we have to stay vigilant, flexible, and involved.
Thanks for listening. This episode is brought to you by mynews.studio. Try it now, free.